I'll be honest with you, I spent the first 5 years of my career fueling the opioid epidemic. I'm not a Sackler, I have no ties to pharma, wasn't making drugs in my garage, I'm just a family doctor who was duped. I started my career in the late 90s. I worked in a community health center. And I took care of people who had so much pain. Car wrecks, domestic violence, manual labor. They came to me with terrible suffering, and I wanted to help. If their suffering was really bad, I gave pills, and pills made them better. Patients told me I was the first doctor who ever really listened to them, who cared about them, who listened to their pain. Because it's true, opioids relieve suffering, whether it's physical suffering or emotional suffering, but it's a false promise because the relief doesn't last. I would see people every month, and every month they just get a little bit worse. And they say, Doc, can I just up the dose a little bit? I just don't feel good. I don't feel like I used to feel. More pain led to higher doses led to more pain. Everyone got worse. Some ended up with addiction. Some ended up stuck on these pain pills they couldn't get off, but they didn't feel better either. Because we've learned a painful truth. The brain can't tell the difference between OxyContin and heroin. Opioids flood the brain with dopamine. And we've learned that dopamine is that chemical that works our reward system. It helps us survive. It gives us pleasure when we do the things that improve our survival, like eat and drink and have sex. And the dopamine levels go down. We feel terrible when we do the things that put our survival at risk. And our brains, over evolution, were finally trained to keep these levels in a really narrow range. The first hit of heroin, it goes up tenfold. And the brain says, that's not going to happen again. It cranks down your dopamine production. You just don't make dopamine anymore. It kills off those cells that respond to dopamine. So over months to years, your brain doesn't work like it used to. You actually need opioids to get up to that barely level functioning, where if you're someone with addiction, you're chasing that high to not feel sick. And if you're someone on pain pills, your whole life revolves around that prescription. And that's the awful truth, is you get there even if you took pills exactly as the doctor ordered. Fortunately, we do know the way out, but the path out's not the path we've been on. And with deep respect for my law enforcement colleagues, we heard today that, yes, we need you to go after big drug dealers, but we can't prosecute our way out of this epidemic. We've spent $1 trillion on the war on drugs. It led to mass incarceration of people of color. And we heard the Surgeon General's story. People of color are arrested more, jailed more, given longer sentences, less parole. 10 years for $200. And often for drug crimes that are far less than how white people are treated. And in this country, we criminalize addiction and we treat people differently on race. And Wanda Sykes has a great routine on this. How many Wanda Sykes fans do we have in the room? You know what I'm talking about? All right, so she says like, oh yeah, now we're talking about treatment. Now white people are involved. Oh yes, the doctors are all over that. But she says, I watched a lot of TV in the 80s. I never saw a show where the SWAT team burst in and they break open the door and they say, hands up, we gotta take your blood pressure. We don't gather people in a corner and say like, how are you feeling? So we're in a different time, and we really have an opportunity to do things better. And we know it can be done because other countries have done it. You know, France is often cited as an example because the heroin deaths were escalating, and they dropped 80% in less than 5 years. In comparison, the US opioid overdose deaths have doubled in the last 5 years. So in France, they elevated treatment over punishment. They made treatment easier to get than street drugs, and deaths plummeted. It's a real framework shift because we know the science, now understand how the brain changes and what makes addiction a chronic disease. We know medications like methadone and buprenorphine drop death rates in half. They work because they stabilize that brain chemistry and they enable people to get into recovery services, to pay attention to behavioral health treatment. I mean, tragically, we don't have a medication for methamphetamine, but we have good treatments for all substance use disorders, but most people don't get them. And that's what we can do differently. There's 100 things that you could throw at the opioid epidemic, but I would like to argue we should work on the 3 things that we have proven can drop overdose deaths now. The first one is we need to stop harming people that we aim to help. And I'm talking about patients like mine who are stuck on pain pills and they can't get off of them. They come to profound harm when we cut them off. Half of them end up in the hospital. If we create opioid refugees, then these are people at risk of suicide and overdose harm. We have to take care of the people that we put in harm's way, and that means maybe slow tapers, maybe maintenance on the same drugs, maybe even buprenorphine, which works well for pain as well as addiction. We have to take care of people who are in harm's way. Second, and I would argue most importantly, we have to make treatment easier to get than street drugs at every point in the system where someone may touch. In California, we call that treatment starts here. In withdrawal, in an emergency room, treatment starts here immediately. In going to see a primary care doc or a psychiatrist, treatment starts here. In jail or prison, California now's prison system has announced that they are going to screen everyone for substance use disorder and offer evidence-based treatment for everyone, whether it's methamphetamine, alcohol, opioids. This is a proud thing. Treatment starts here. We need to have, yes. Who here works for CDCR in the prison? Who? Yes, they need a hand. So we need a healthcare system that can handle brain diseases the way they handle physical diseases. But we also have to look outside the healthcare system, and that means embracing harm reduction, which is the third piece of the solution. So let me give an example. How many people had a New Year's Eve where they made a commitment to their own health? I'm going to exercise more, I'm going to eat better, I'm going to sleep more. Now keep your hand up if you kept that commitment for 365 days perfectly without a mistake. Right? That's harm reduction. We are human beings, we are not perfect, and we make mistakes. So imagine a healthcare system where we embraced human fallibility instead of punishing it, where we said to someone, I don't care what you're using, I don't care if you're ready to quit, come on in, we welcome you. We'll give you clean needles. We will give you Narcan. So just like I, at the end of the year, can say, well, I exercised on most days, I slept when I could, I ate better on some days, that's good enough. Like imagine if we said to someone who's trying to quit, kudos, good for you, you avoided use on most days. You went to counseling on some days and you did the best you can. We are going to give you kudos, welcome in, we will take care of you. Imagine that your kids don't get taken care of you. If you don't lose custody of your kids if you make one mistake. You don't lose your freedom on parole if you make one mistake. I'm a family doc, and I'm delighted when my diabetic patients do a great job 29 days a month, and then one day a month they blow it on ice cream. I say, good for you. That's harm reduction, and we know how to do that. So we have three things that we know will stop deaths. We take safe care of the people on pain pills. We make addiction treatment easier to get than street drugs. And we embrace harm reduction. We treat people like human beings. The last thing I'll say is we can't make it all about opioids. We can't create a one-drug system of care. We have an incredible opportunity in time with bipartisan support, millions of dollars flowing in, so much national attention. Well, let's do it right. Let's make a system that works for all substance use disorders, all brain diseases, and again, something I'm proud of that we're trying to do in California. So I had to accept some hard truths. I had to change. I had to recognize I was part of the problem. And I hope the health folks in the room and the law enforcement folks in the room can face those hard truths that we've been on the wrong path. But we know what to do. We can do better. And as the Surgeon General said, we'll only do it together. So thank you.